After 3 lifts with revisions, is it safe to have another lift to the lower neck and jowls?
Thank you for your question. You've submitted 2 photos and you're asking if after 3 neck lifts with revisions, is it safe to have another neck lift to lift the lower neck and jowls? Well, I can certainly share with you my approach to situations like yours in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Face and neck lift is a very significant part of my practice, as well as non-surgical options to help people with facial aging changes, which is when people seek out this type of surgery. So the first question I would ask someone like yourself is, what exactly are you looking to try to improve? With the photo you submitted, and I look at the area that you would refer to as jowls from the front, it doesn't appear to me that you have significant jowling. What I would like to maybe offer as a perspective for you is an awareness that I've had for many years, and in this stage of at this point of time, in this stage of my career, I'm very happy to report that there are options that are better than they were 15, 20 years ago. So to begin with, let's start with the definition of a jowl. A jowl is usually the result of loose skin and some fat that is below the jawline, which is why it's indicated to do a face or a face and neck lift. When someone complains about jowling, very often what they aren't appreciating is that there's loss of bone in an area called the mandibular notch. Now that makes the area next to it look elevated or more prominent, and people think it's jowling. So what happens is a lot of times people feel like their skin needs to be tightened, and a surgeon will try to tighten the skin, and the patient will still feel like they have a jowl. So to address an area of deficit in the bone structure, and understanding that facial aging is a combination of descent or sagging and volume loss, there's a strategy that we employ called structural volumizing. What does that mean? We're actually using fillers that are placed in this level between the bone and the muscle that fills out this area and improves that area of bone muscle or bone loss, which is below the muscle. Now, this is an area that I could also offer a patient a permanent solution, such as a pre-jowl implant, or if someone has a weak chin, putting a chin implant in that place, because the tail of the chin implant actually fills in part of that area. Now that's one element of this equation that could be approached without needing another surgery. The other part of this equation has to do with skin quality. Many people after surgery will complain that they've had a surgery done and then their skin is still loose and that the doctor didn't tighten the skin enough. I can assure you that in myself and my colleagues who perform facelift and face and neck lift, we do our best to make the skin as tight as is appropriate without over-tightening or creating those undesirable tension lines. So why do people feel this way? It has to do with skin quality. The actual makeup of the skin, the loss of collagen, actually makes the skin stretchier. So when it comes to skin quality, you're not going to benefit from just more pulling and lifting. A colleague of ours, a plastic surgeon, said years ago that the skin is like taffy. The more you pull on it, the more it can stretch. And that's a very meaningful statement. So in our practice, we actually have a non-surgical approach to skin quality improvement in the face using a thermal energy device using a laser. Now this is a laser which is non-ablative. It's actually heating the deeper tissues of the face as well as in the skin to help remodel the skin and to improve the quality of the skin. So a non-surgical approach, again, is offered there. I often combine this with something called platelet-rich plasma, which is derived from your own blood to stimulate your body's collagen and blood supply. The challenge is that with aging changes and then compounded with sun exposure, the skin becomes very thin. And so it becomes a balance of how much to lift and how much to actually rehabilitate, as well as to improve volume quality in a strategic way. A lot of times, when we talk about structural volumizing, just going back to that, the point of doing it in the level that we're doing it is that the skin is now not a critical factor. When fillers are typically used by most doctors, it's placed within the skin, either at the dermis level, the backbone of the skin, or under the skin. Unfortunately, the skin can only tolerate so much weight, and therefore you can't get as much of a correction as you can when you do it at the bone level. So the photo that you submitted of showing the lower neck, we might be also dealing again with a skin quality issue and not with a skin quantity issue. There are terms for the aging changes of the neck, such as poikiloderma of Savant, or other changes of fine lines and wrinkling and discolorations, telangiectasias or little blood vessels, and just generalized quality diminishing with aging. People often want their skin lifted to make things look tight and good, because when they stretch the skin, it looks good. But unfortunately, there's a limitation because you have to turn your head and move around. So that's, again, something that's more amenable to PRP and laser treatment. So as far as answering the question, is it safe to do another lift, I'd say it is typically safe unless there's any issue with the blood supply, vascularity, and the quality of the skin. But I think that you have other options to address the issues that concern you. So meet with doctors, maybe meet with the original doctor who performed these procedures for you. Learn about these other options. Fillers to add volume, lasers or thermal energy devices to improve skin quality and skin tightening, done intelligently and strategically. Too much of anything is never a good thing, but doing it in the right amount in the right way can really make an impact. So I hope that was helpful. I wish you the best of luck. Thank you for your question.